Hey everyone, my name is Mint and I was just doing some research about something called Graves' disease. So, for the topic for today, I guess we'll discuss about Graves' disease then.
So, what is this so-called Graves' disease? Graves' disease is one of the most common of all thyroid problems. It is an immune system disorder that results in the overproduction of thyroid hormones, or we can call hyperthyroidism. Let's dive into the history of this disease. Graves' disease was founded by both doctors that reported two different cases with the same symptoms, Dr. Robert James Grave in 1835 and the German Karl Adolf von Basedow in 1840. As a result, it has two names, Graves' disease and Basedow disease. Now, let's see what the cause of this disease is. In order to understand this, we need to look into the function of the thyroid gland. Let's talk about the brain first. The hypothalamus. Hypothalamus has an important role of connecting the nervous system to the endocrine system via the pituitary gland and releasing the hormones. Below the hypothalamus is the pituitary gland. We have the thyroid gland located right below the larynx. The hypothalamus secretes thyroid regulating hormones, or TRH, and this hormone stimulates the anterior of the pituitary gland to produce thyroid-stimulating hormones, or TSH. These hormones will travel through the circulation and reach the thyroid gland. The thyroid gland itself has receptors for TSH called TSH receptors. This binding will stimulate the thyroid gland to recreate and release thyroid hormones, including T3 and T4. These hormones then will travel in the circulation by thyroid binding protein. So, what's the function of T3 and T4? When they reach the target cells, they will detach from the protein and go inside the cells. Since T3 is more effective, T4 is converted into T3. T3 then will attach to the thyroid hormone receptors within the nucleus. This will stimulate the production of protein, enzyme, and everything else. Overall, increases the metabolic rate and sympathetic activities. If T3 and T4 are produced too much, this will be considered hyperthyroidism. So, what is the cause of Graves' disease? When there is an infection, the TSH receptor antibody produced by the plasma cells will attach to the TSH receptor of the thyroid gland, and instead of suppressing the activity, they enhanced it. Consequently, more T3 and T4 are produced, leading to hyperthyroidism. There are two more types called the thyroglobulin antibody and the TPO. So, how do you know whether you have Graves' disease or not? Here are some symptoms. First, anxiety and irritability. Stress also contributes greatly to the cause of this disease. Second, enlargement of the thyroid gland, or goiter. You'll see your neck somewhere close to the Adam apple will also be somewhat swell or bigger than normal. Thirdly, shortness of breath, difficulty breathing. Sometimes you'll find it's hard to breathe because of the enlargement of the thyroid gland, blocking coming in. Fourth, bulging eye, Graves' ophthalmopathy. This is a common symptom for Graves' disease. Next is fatigue. You might also feel really tired and have no interest in doing anything. And next is thick red skin, usually on the shins or top of the feet, are also called Graves' dermopathy. Well, we already know what the symptoms are, but who is actually at risk? People who have, first, family history. Having family members who used to have Graves' disease also increase the percentage of having this disease. Two is age. After the age of 45, you will have more chances to encounter this disease. 3 is sex. Women tend to be more vulnerable to this disease. 4. Other autoimmune disorders. Being pregnant is also a disadvantage when it comes to Graves' disease. Pregnant woman who has Graves' disease might have bad consequences on their babies. And lastly, smoking. So, how many people in the world have been affected by this disease? Well, every 200 people, there is one affected. So, there are about 35 million people in the world affected by this disease. So, what are the tests for this disease? The first one is ophthalmopathy. The doctor will examine your eyes to see if they are irritated or protruding, and looks to see if your thyroid gland is enlarged or not. Second is blood sample. So they will test the levels of thyroid stimulating hormones, TSH. TSH is the hormone that stimulates the release of T3 and T4. And just like what we discussed, these are the cause of Graves' disease. The third one is radioactive iodine uptake. The fourth one is ultrasound. And the last one is imaging test, just like MRI or CT scan. So what are the treatments for this disease? First is the radioactive iodine therapy. So it's technically a pill which when you swallow, it goes in through the thyroid cells, and the radioactivity will destroy the overactive thyroid cells over time. And these side effects will be including tenderness in the neck and a temporary increase in thyroid hormones. The radioiodine therapy is in use for treating pregnant women or women who are breastfeeding. So the second one would be anti-thyroid medications. These medications will interfere with the thyroid's use of iodine to produce hormones, and the side effects are rash, joint pain, liver failure, and it will be limited use on pregnant women. The third one will be beta blockers, and they will block the effect of hormones on your body. The side effects, however, you cannot use on people who have asthma or diabetes. The last resort will be surgery, and will remove all or part of your thyroid. And the side effects will be potential damage to the nerves that controls your vocal cords and the tiny glands located next to your thyroid gland.